President Trump's long-awaited health care plan is finally here, except that it isn't really a plan at all. It's just a single page that the White House is touting as a framework for Congress to work with. As the Washington Post puts it, the proposal does not include new ideas to expand health coverage or simplify America's often Byzantine health care system. It also falls far short of Trump's promises to deliver a replacement for the ACA. I want to bring in MS Now White House reporter Akayla Gardner, and former Congressman Charlie Dent is back with us. So, Akayla, walk us through what Trump is calling the Great Health Care Plan.
Chris, the biggest part of this plan is a plan to extend payments directly to Americans to cover their health care cost. But exactly how much they could receive and through what vehicle that money could come, that's totally unclear. It seems the White House is leaving that up to Congress at this point. But there's also proposals to codify or expand executive actions that President Trump has already taken, including the administration's most favored nations policy, which essentially pegs the price of certain prescription drugs to the cheapest price available in other comparable or wealthy nations. It also has a plan to compel insurance companies and providers to prominently display all costs upfront in plain language to consumers. But it is by far a comprehensive health care plan. It is not substantial enough to replace the Affordable Care Act, but President Trump continues to talk about it as a replacement. Take a listen.
You're going to have great health care at a much lower price, which is the two things. We want great health care and we want low price. You're going to have great health care at low price. Now you have terrible health care at a high price. You have horrible, horrible Obamacare health care. I think we can make health care into a Republican issue because the Republicans are going to be close to unanimous on this. It should be unanimous. Maybe we will be unanimous, but it'll be close. But we have a small majority. We probably need a little bit of help from the Democrats. So whatever we can do, we're going to do it.
Yeah, and at that event earlier this morning, President Trump was telling his Republican colleagues in the room to talk to both of their Republican and Democratic colleagues to get this plan across the finish line. But this comes at a time when talks have stalled to extend Affordable Care Act subsidies in Congress. But an administration official says this plan does not close the door on those negotiations. Chris?
Thank you for that, Akayla. So, Congressman, Democratic Rep. Mark Pocan told my colleague Lawrence O'Donnell last night that this all feels a bit oddly familiar, and here's what he said. Why?
Now, remember in middle school when you had that assignment for a couple months, and the night before you put something together and you never read the book? And, you know, that's what Donald Trump tried to do. He didn't quite get there. He has one page, one side only, with a bunch of platitudes, as you showed. And, you know, this guy's had 10 years to come up with a health care plan. Instead, they cut health care for 15 million people.
So given that this plan really isn't as we would know it, or you in Congress would know it as a real plan, what do Republicans in Congress do now? Can they just do nothing?
Well, I think the congressman made a fair point, actually. If the president has a serious health care plan, he should present it to the United States Congress in bill form. And then we can see what it will actually cost, how many people will be covered, and more importantly, how many people will lose coverage. That's what Congress needs to see. The Congressional Budget Office will score this thing. That's what happened in 2017. Congress put together a plan and, you know, north of 20 million people were going to lose coverage. And that's why it all fell apart. And that's the problem right now today, because Republicans passed helped pass the extension of the premium subsidies, the enhanced tax credit subsidies. They just did that a week or so ago. They did it for a reason, because they know they're very vulnerable on this issue, particularly with independent voters. There is a vulnerability here. Even if Republicans pass whatever it is they want to pass and it became law, it could take, you know, a year or two to stand that up. So in the meantime, they know they're going to have to extend these enhanced premium credits. So that's the reality of this. So if the president has a plan, write the bill, send it to Congress. A one-pager doesn't do anything. Just saying that healthcare costs too much, it's going to be beautiful, and everybody's going to be covered. That doesn't work. Those are just slogans. You need to actually have real legislation here that can be chopped on by everybody.
Yeah, we've already seen a significant drop in Americans signing up for the ACA because of rising costs. And my colleagues here at MS Now talked to one single mom, for example, whose daughter had to drop out of college to help them pay for health care. Take a listen.
I'm having to ask my children to help me do things that should only be my responsibility, and that has broken my heart. I think that's the hardest part. Yeah. They should concentrate on going to school, getting good grades, making friends, not paying a bill.
And look, we know she's not alone. The president said, we're just going to send people money so that they can buy health care. Are voters going to be placated by that? They're still waiting for that $2,000 check that was promised.
Is that to me? Is that question to me?
Yeah, I'm sorry. Yeah, please.
Oh, sorry. Yeah, okay. Yeah, look, the problem with the proposal the Republicans are advancing, health savings accounts, flexible spending accounts. These are not new ideas. Association health plans, all these things you've heard. These ideas are 20 years old. The problem is that healthcare is not a static issue. It's a dynamic issue. And Republicans just cannot pretend that we can just go back to pre-Obamacare, pre-ACA. We are where we are, and we have to deal with the realities such as they are. So that's why I think it's incumbent that Republicans get serious about extending those subsidies. I think they have to do that and then come up with a plan. If they can come up with one that can make health care better, I'd be all for it. But you can't write a plan, though, that will end up causing millions of Americans to lose their coverage. And they're learning the hard way that, covering people costs money. It's hard to cover everybody and do it for less money. And that's why this is a very difficult issue for everybody, Republicans and Democrats. So time to get serious, folks, on this issue. And, that woman, I think, illustrated, just the challenges that real people are facing. As I said a moment ago, Republicans know that this issue on health care is particularly going to harm them among independent voters, and it will only get worse over time.
Kayla Gardner and former Congressman Charlie Dent, thank you both.